Welcome to LYLAS. If you grew up in the 90s and you know what that stands for, then this podcast is definitely for you. Today, we're going to lighten it up. If you've been listening to the last couple of weeks, we've hit some of those heavy topics. We've had some amazing guests to the show so far. We've been super lucky. And today, we've got another super exciting guest joining us. Today, we're going to talk all about sex. Let's talk about sex, baby.
God,
And
I
I
can't
both
wait.
titles are like 90s song titles. I don't know. Today we have a licensed counselor, sex therapist. I don't know what the technical title might be. Michelle Leach. So welcome to the LYLAS podcast.
Thanks. Yeah, so I'm an LPCA, but I've done a year of extra post-grad work for sex therapy. So eventually I will be a certified sex therapist.
Excellent.
Yeah.
So we
Gosh.
actually, funny story, we met at our children's school, sitting in on a school improvement council. And I was just curious. I was like, what do you do for a living? She's like, I'm a sex therapist. I'm like, this is fantastic. Didn't even know that existed. Makes
Yep.
sense because Tiger Woods, we all remember Tiger Woods had um, some sort of issue that he sought some treatment for. So it makes sense that it exists. But how do you get into that specific area of counseling?
Yeah. Well, that's a great question. I actually had a girlfriend who said, you know what you would be really good at? And she said you would be a great sex therapist. So that's honestly why I'm here. But I think we expect kids at the age of 18 to enroll in college and know exactly what they're going to do with their lives. And not, that's just not reality. So I started my career as a high school history teacher, and then I quit to have babies, and I was a wedding photographer for 10 years. And then kind of was like, what do I want to be when I grow up? And I had a girlfriend who was also in the process of becoming a licensed marriage and family therapist. And
Mm-hmm.
she was like, you'd be really good at this. Cause I was always that girl who, if you have the one friend who talks about sex and you feel comfortable with, that was always that person for my friends. And so now I just get paid to do it, which is great.
God, that's cool.
Yeah.
Right.
I know. Thanks, Lauren, wherever she is. Thank you, Lauren.
That's awesome.
Yeah.
So tell us a little bit about like how do people find or seek out a sex therapist? Is that like a referral that comes from your primary care physician, or like how do you find somebody or know that it's maybe the right thing for you?
Yeah, I think it can be. I get a lot from pelvic floor therapists and OBGYNs.
Mm-hmm.
Because if you think about going into your OBGYN's office, I think your appointment time is billable for like 15 minutes, right? And then beyond that, the doctor can't really charge for that. And so they typically will send them to me. But I also think that similar to general clinical therapy, you don't really have a problem with things until you have a problem.
Mm-hmm.
So oftentimes if you see a married couple in therapy, they're not like, hey, we're really doing good. We just wanted someone to help us check in with each other. It's usually like, we're about to get divorced, right?
Yeah.
Or like if you see an individual, they're like, my life is falling apart. That is what brought me here. So it's very rare that I see clients who are like, I'm having all the great sex. I just wanted like your advice on things. That doesn't happen. So it's typically people who are realizing that sex is not what they expected it to be or not what they were
Mm.
taught it was going to be. And so then that's when they seek out help.
That's so interesting because I feel like I don't know, growing up in my household, we definitely never talked about sex. Like that was my mom handed me like a Cosmopolitan magazine. It was like turned on 90210 and was like, here you go, figure it out.
Yeah.
It just wasn't like a topic. And I don't know that people do. I mean, I certainly am not talking to my 8-year old necessarily about it. But it is such an interesting and necessary topic because so much comes with that. Like you said, you're 18 and you're just expected to sort of understand everything about our bodies and how they work. And there's just so much that goes into it and the impact it certainly can have on your mental health if you're not having good sex.
Yeah. Well, I joke with my friends. That's kind of the question I love asking if we go out for drinks is, did you feel prepared for your first consensual sexual encounter? And no one is like, yes, I actually felt so prepared. I knew what my body was going to do. I knew what their body was going to do. I roughly knew what to expect. No one knows, right?
Mhm.
And what I tell parents is it's 100 1-minute conversations. So we also psych ourselves up as moms, like, got to have this whole talk. I've got to buy all the books and I've got to have all the websites for them to click on. And it's like, you really don't. You just kind of let them bring it up. And if they
Mhm.
are bringing stuff up, you try your best not to squirm, right? And you just say,
Mm.
hey, I'm a safe place for you to ask any of these questions too. And I've known a lot of times it happens in the car line, right? And
Yeah.
so my son will say something, and that's what 2 minutes worth of a conversation. He's like, cool, well, bye, mom, have a great day. And it's like, okay,
Mhm.
I hope I did my best with that one, right?
I love that. That's such a great tip. Like to think of it not having it one conversation, having multiple conversations over time, just little snippets that hopefully kind of stick with them and overall sort of build this body of knowledge.
Mhm.
Right.
I love
Yeah, because
that.
I've definitely pushed with my kids. I'm like, do you want to know more? And they're both like, nope, we don't. We know to come to you, but we don't want to know more. And so that's kind of when you know,
Mhm.
all right, we can pull back.
Yeah, and I think you're right. In topics like this, approaching it like as a dosing kind of perspective is helpful because then you're able to give your kid just what they're needing in that moment, and it can have a building process later on or even check-in process, but that really does just help to kind of fill that cup of need right where it's at and then just kind of move on. And as parents, I just think that that takes so much weight off because when we
Mhm.
were growing up, it was like you have to have the talk. And
Mm.
what the hell is that? How long is it supposed to last? Like, where's
Right.
the, curriculum that we're supposed to go through? But I do like your point about just kind of dosing it out as a very moderate and digestible kind of way to dispense the information for sure.
Well, and you've got to think as a parent, if you are not the one providing that message, they're going to hear about it from school. And what is the message that school is providing? They're going to hear about it from their friends.
Mhm.
What messages are their friends giving that their parents gave them? Or what did they learn? Or were they clicking around on the TV and saw something like, and then now they're going to relay that message to your child. So for me, I wanted to be on the forefront of that, right? Like you're going to
Mhm.
Mm.
hear about this stuff. Friends are going to say things. Um, but the way, so real brief, Emily Nagoski is one of my most favorite sex educators. She wrote the book Come As You Are. She talks about this garden. And so for a lot of my clients, we talk about their own garden. What messaging about your bodies, what messaging about sex were put in there when you started to have the sex, whatever the sex looked like for you? Did you have weeds in your garden? Did you have thriving flowers? Right? It kind of goes back to that question about did you feel prepared for your first consensual encounter? Um, but as parents, then we have to acknowledge our kids have a garden. So they're
Mm.
seeing us look at our bodies, comment on our bodies. They're seeing our
Mhm.
relationships, our partners. All of what we do and what we say to our kids, even in that little dosing, is kind of going in to feed this garden. And, someday they may be on a sex therapist's couch reprocessing what that garden looks like. But I really like to look at it as that, not only from a parent standpoint, but then as a clinician standpoint, I look at my clients and say, what were you taught about sex, and what
Mm.
did they say, and who said it? And right. So I feel all of it, I think, is necessary and goes into how people find me and why they're here.
Mhm. Mhm. Mhm.
Yeah, absolutely. I can totally relate to that when you just think about, all of the people that maybe experienced trauma as a child and how that's later going to affect their sexual experiences or how they feel about their bodies or how comfortable they feel showing their body to someone else, even can
Right.
certainly affect them later in life. Would you say the majority of your clients are in relationships and they're struggling to orgasm, or is it primarily um like we're saying, like people that feel uncomfortable with their body or they're not maybe interested in even having sex? What would you say is the primary barrier to a healthy sex life?
Oh, that's a big one. Well, I would say that almost all of my clients, almost all of my friends that reach out to me, they'll DM me on Instagram or whatever. Almost all of those folks are looking to figure out if they're normal,
Mhm.
Mm.
right? And there's no normal, as we all know. But I think that trying to get that question answered is a barrier for people, right? Because it's
Mhm.
like, how frequently should we have sex? Um, what, why is my body doing that thing? Or why, when my partner grabs my hands and kind of ties me up, why does that excite me? Is that okay? Is that not okay? Like, I hear the word broken a lot in my
Mhm.
space, right? Like, oh, I'm just worried that I'm broken. Please tell me that I'm not, or please tell me how to fix myself if I am broken. So there's actually a lot of normalization. There's a lot of, and I do think that some of those things can definitely go back to our childhood, and what we learned about sex, and then how that plays out in our adult, sexual, experiences. Um, but I think that a lot of times the barrier to having good sex, or the barrier to people, well, no, I'm going to say it's communication.
Mhm.
I think
Yeah.
it's communication. I think that we just don't know how. I mean, think about when y'all got married and you're trying to deal with finances, right? Or you're trying to, pick a school for your kids to go to, or I mean, that's obviously later on down the road, but I think about all the difficult conversations you have with your partner. And then on top of it, you have to talk about sex, and how do you do that? And sex can be so fragile for some people. So people can take it personally,
Mhm.
right? And it's like, I'm not trying to make a comment on you as a person or your body. I'm just saying, this doesn't feel pleasurable for me. How can we maybe do something different to achieve what pleasure for both of us?
Mhm. Mhm.
So I don't know if that answered your question, but I do
Yeah,
feel
it does.
like, one thing that I joke around a lot about is, what is your biggest sexual organ? And then I am always like, it's not his big dick, right? It's your brain,
Mhm.
For
right?
sure.
Being connected in that moment. And, yeah, so that's why gotta love biology. But for men, right, they can be more aroused in the morning. For women, they're more aroused in the evening. And I love that. That's another normalization tip that I give couples, because for men, they're like, what better way to start out my day than clearing my balls? This just feels, what a great start to the day. For
Yeah.
women, I don't have my to-do list out with me, but we have a to-do list in our head. So we're like, okay, got to make the kids lunches, got to pack this, got to make sure I do this. And so
Mhm.
at the end of the night, you're like, you know what sounds really great? Let's just connect sexually. Whereas like men are like, oh, I'm done with the day. Right. So I just think communicating about those things, knowing, um, about even biologically what feels right for us and our bodies, I think that can be so helpful for people.
Mhm. Well, and that speaks to a level of intimacy too, because there's a difference, I think, in emotional and relational intimacy than physical intimacy. And correct me if I'm wrong, but women tend to need to have that kind of emotional intimacy with their partner in order for them to sometimes even experience pleasure out of sex, or to feel like having sex, and just to kind of have that as a basis for the development of things moving forward. Is that what you find in your practice too?
Yeah, and one of the first things that I tell, my my vulva owners, whatever, my female clients, is to start tracking their cycles, because it can also be time of the month that can affect their sex drive. Um, I tell people that I kind of practice from a feminist lens, which says, my clients come in and everything affects them. So I look at my clients that sit on the couch and I see invisible bubbles like over their head. So
Mhm.
our sex drive is motivated by, our families, our stress levels, our jobs, our friendships, our culture, our society, our religion. Our sex drive is affected by everything. So it's not just having that emotional safety with a partner,
Mhm.
because I do think that women are capable of just having a good sexual encounter that is, you know, full of passion, but maybe nameless or faceless or whatever.
Mhm.
It's not,
Mhm.
it's not really that connection with their partner. I think women are capable of that. Um, but I think if a woman has done the laundry and the dishes and cooked dinner and packed the lunches for the next day and done homework with the kids, all of that is going to tank you a little bit, and you're not going to have the energy to even open up for your partner in that way.
Mhm.
Yeah, that sort of mental load, as we always refer to. If
Mhm.
you're the one doing the majority of those types of tasks by the end of the night, like you're just spent. If you're like me, you're passed out with your kids at 9:15
Right.
because you're exhausted, and then
Yeah.
you're going to get up and do it all over again the next day.
Right.
Um, but what a lot of what you're saying is so validating. I feel like anytime I get in a situation or a group of girlfriends, and inevitably we always end up talking about sex, everybody's always asking, well, how often do you do it? How, we're all sort of trying to validate each other's experiences or sort of like compare, is this normal? Am I normal? Like you're saying.
Right.
But it is always interesting to me to hear how different we all are and the different perceptions that we have, or just the different needs that we have. I have girlfriends that can't get enough of it, and I have other girlfriends that they're like, I wish my husband would get off of me. Like, I don't, and again, I think a lot what you just said makes a lot of sense when they're carrying a lot of the mental load. That makes sense that they're just not as excited at the end of the night, maybe as their husband is.
Yeah. You could also be carrying a lot of the mental load, but it's that time of the month where your body says it's time to make babies, even if you're,
Mhm.
actively preventing making babies, your body doesn't know the difference. And so you might be like, why am I more aroused right now? Why do I want to jump all over him? But that's why I ask women to track their cycles so that they also kind of have a little heads up like, hey, I'm probably going to be a little bit more aroused this week. So lucky for you, but also please help take care of me in that way.
Yeah.
It's communicating your needs, identifying your needs and communicating your needs are so difficult. But I do love that question. How often should we be having sex? I was at a pool party last summer with a bunch of kids and I had a mom ask that question. And I just say, you know, uh there's no magic number. I think I was also stopped at a wedding a couple years ago and I had a woman ask me, they had not had sex in 16 years. And she's like, is that a problem? Is that a problem?
Mm,
And I said, it's not a problem if it's not a problem.
yeah.
So I checked in with her partner. I was a wedding photographer at the time. I wasn't even trained to be a therapist, but I was like, well, does her husband care? She's like, nope, he loves his life. I'm like, okay. If you are having sex once a week and that feels good to both of you, it's not a problem. If you have sex every night of the week and you both enjoy it and it's not a problem to either one of you, not a problem, you know?
Yeah, but I think everybody can tell when it's been too long. I don't know. Maybe it's just me, but I'm like, because you always just fall out of sync and then you fall right back in sync. You're like, oh, we just needed like that connection again. We needed to kind of get back, especially when you have little kids and you're just go, 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 and you're putting all your effort and energy towards them. It's so easy to kind of create space between you and your partner. And that I feel like always sort of like brings you back together. I don't know.
Yeah. Yeah.
Maybe it's just
I
me.
would, no, I would agree. I would definitely agree with that. And I think it can be so hard to lose ourselves in our identities as moms and forget that we have an identity not only as a partner but as a woman, right?
Yeah.
um, so it's just remaining aware. But you're talking about that mental load got on top of it, now you're asking me to remain aware of myself and like what I need, and it's like it can be a lot.
So how do you like coach someone through? Let's say that they're having a really hard time expressing or communicating to their partner, like I like this or I don't like this, or just those types of things. How do you sort of like coach your clients, or is that something that they just sort of develop over time at getting better communicating?
Yeah, that's a great question, and it obviously differs for everybody. I think um just in general, communicating your needs to your client, or not your client, your partner, I think can be really difficult because you're opening yourself up for rejection,
Yeah.
saying not only this is who I am, but this is my need. Like I'm gonna hit that time of the month next week and I need to have sex more often. But that also allows your partner to say, I can't do that for you. I don't want to do that for you. Or even worse, right? They say, yes, I will do that for you. And then they don't do it for you. And then
Mm-hmm.
you build resentment, right? And so after a couple, months of that, then you're like, all right, forget it. I'm not going to communicate that need anymore. And it kind of, stifles it. And so it doesn't stifle the need, but it stifles that desire to communicate openly with your partner about your needs. So, um, I always tell my clients to hold themselves gently. I feel like, um, honestly, knowing your body, I think, is a really important piece of it. I think that learning how to communicate about what you like. I heard a podcast one time that, someone said, oh, I brought up, reverse cowgirl or something to my partner. And I thought, oh, let's try a new position. And they're like, oh, that sounds gross. And they're like, exactly. That's exactly why I want to try it. Right. Like, you're my partner, you're safe. Let's try something new. Let's spice it up. So I think that, yeah, it's just being brave. I think is like
Mm.
the hardest part, be brave. And you have to be able to tell your partner, I'm not sure if this is what I need, but it feels like it's kind of a need for me that's coming up right now. So what do we think about this? Right.
Yeah,
So,
because they should be your safe space. If you could share that information with anybody, you would think it's
Mm-hmm.
whoever you've partnered with in life.
Mm-hmm. What do you
right.
do in those circumstances though, where the partner just might not be filling that need? Is that a role that you also tackle as a sex therapist then? Like if they're just like, oh, it's not what I want to do. It's not my need. I don't feel like that I should have to do this. Like where do
Yeah.
things go at that point?
How much time do you have?
I
No,
know.
I mean, I think that's a really tough one because as a clinician, as someone who is, I would say, sex positive, I never want to coerce or manipulate or convince a client that they should have sex.
Mm-hmm.
Um, Oftentimes, it just takes a little bit of talking. We're talking about that mental load, right? So you've got a client who one has a higher libido than the other. And there are some assessments that I have to kind of help identify that for clients. And then they feel that's another level of normalization for them. Like, oh, I'm not crazy and horny. I just have a high sex drive,
Mm-hmm.
right?
Mm-hmm.
Yeah.
But oftentimes when I talk to the low libido partner, there has been either some break in the relationship or there's a very heavy mental load being carried by that person and they're just exhausted. Most sexual dysfunction is caused by anxiety. So I do a lot of anxiety control in my space, right? So it's talking it out oftentimes. Sometimes there are people that absolutely have a low libido. Either there's an illness or there's a hormonal change or difference. And so then I normalize the higher libido partner's need for sex, right? We normalize that. This is a part of who this person is. How can we work together to see that achieved? Um, and oftentimes I like to be a little bit spicy. So oftentimes I will say, what do we think about opening up the marriage, right? If you're going to be with this partner and your partner is saying, absolutely not, I don't want to have sex. I'm done with this part of my life. This is their problem. This is not my problem. A lot of times I will lob that, okay, well, what do you think about opening up your marriage and allowing them to find that sexual gratification with somebody else? And that is when people are like, oh, no, 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 no. Right.
Yeah.
But it does, I think it helps the lower libido partner understand, okay, this is a need. There is a way that they can get this need met. And right now they are meeting with us appropriately, right? And we're having the discussion. We're not looking outside of our marriage for it. So how can we do this in a way that um, feels safe and feels authentic to both partners? Because at the
Mm-hmm.
end of the day, that's what we want. We want both partners to feel authentic within their partnership. And so it's just a matter of how do we accomplish that? Like we can definitely honor the low libido partner. We can honor them. We can say, hey, we get that for whatever reason in this season of life, this is not your cup of tea. However, this is a real need. And I mean, I hate to use the word fair, but it isn't fair if we're going to shut that down in the other person because that need isn't going to go away just because you can't meet it.
Yeah. Yeah. No, I agree.
So I'm thinking to myself, like just having been on several medications in life, they can certainly affect your libido or even your ability to orgasm. I assume that you come across clients that have this problem. Maybe they're on like a depression medication or anxiety medication. So how
Mhm.
often do you sort of connect with like their other physicians or um, other people that they're seeing maybe prescribing these medications? Do you like have contact with them or do you sort of have them relay messages back to their physicians?
Yeah, I can. For a lot, I don't want to say for a lot. Well, for many of my clients, when they come to me and they say I'm on XYZ medication, I kind of do a quick assessment, like, is that working for you? Is it not working for you? How do you feel on this medication? Oftentimes I will have clients that say either, it really doesn't feel like it's effective anymore. So I might want to talk to my physician about that. So
Mhm.
that's kind of on their own. They're going to do that. I have some other clients who are like, this is a non-negotiable. I am the person that I am supposed to be on Lexapro. I am the person that I am supposed to be on Wellbutrin. And so then we just kind of work around that. We say, okay, this is who you are. We can't, nor do we want to disrupt that, right? We want to keep
Right.
on that medication.
Mhm.
So here are some other strategies that we can go about you reaching the sexual fulfillment and pleasure that you're wanting to achieve. But those are real concerns and those are real side effects that I would hope their physician is talking to them about. But then if they're not talking to them about that and they come in seeing me like, I had a really high sex drive, I got on Lexapro, what's wrong with me? I'm like, oh, that is something that will affect it, right?
Yeah.
So it's part of those bubble things that I was talking about. It's just one bubble that it's like, that is probably just a part of it. It's not all of it, but then it's like, okay, who's doing the dishes? Who's taking care of the kids? Who's carrying that mental load for you? Are you doing that on top of now you are on an SSRI that is gonna could hinder your arousal? So I love collaborating with other professionals that are in my clients' lives. And I will say I've seen a lot of progress with pelvic floor therapists. So when I have clients that are working with their pelvic floor therapists, that they've really hit the wall as far as no pun intended, but they've really hit the wall with like what they can do with them. Then we're also collaborating. Like, what have you heard in your space? This is what I'm hearing in my space. Now I can kind of come up with a better treatment plan for how to tackle some of their concerns. So I do love collaborating with other professionals. I just think oftentimes my clients say, don't touch my medication. That's really
Yeah.
important. And I never want to violate that.
Well, and it sounds like you have other tools in the tools box in your toolbox to sort of help them work through that. I know when I was on one medication, my physician was like, no, this is going to have this side effect. And I was like, oh, I don't know if that's good for me. But he was like, you know what, if it does and it's not okay, then you come back and we try something else, So I know that I can, out of my sample size of one, my physician definitely had that conversation with me, but I always think it's important to have like almost like wraparound support. If you're having mental health issues and you're taking medication and it's affecting your sex life, that's also going to affect your it's all intertwined. And so you sort of need these professionals having these conversations so that they can help you in the best way possible.
Right. I also think there's a little bit of normalization to be done around the higher libido partner and their need for sex. I think that oftentimes we as a society can look at someone's sexual need as too much
Mm.
or as addictive or as just not normal. And so I think that sometimes with partners, I will say this can be a form and a way that your partner feels loved. It's not that they're just a horn dog. It's not that they're obsessed with sex. It's not that they're gross and they just want more of it than their other partner, right? It's like, no, this is just how they can feel loved. This is how they can feel satisfied in their relationship. I know that I don't know where y'all stand on love languages, and I
Mhm.
have a love-hate relationship with some of it, but I think that we are all wired so differently,
Mm.
and how I love my partner and how he receives love and how he gives love can all be three different things, right?
Mhm.
And so for me, it's remaining aware, because you can have a low libido partner say, well, um, I don't feel like it's fair that they demand all this sex from me and they're not doing the dishes. Well, that immediately clues me in. Okay, you feel loved when they are doing that act of service. You
Mhm.
feel that love when they are taking that load off of you. But then we also have to flip it and say, but your partner feels loved when you offer your body up to them, or when you are intimate with them physically. They feel so much love. It's not that their sex drive is abnormal or crazy or high. It's just like, let's look at it as an act of love. We're doing the dishes, that's an act of love. We're having sex, that's an act of love. And a lot of people they just don't connect that. And so I've
Mm,
found that to be really helpful with partners.
that's fair. I mean,
Mhm.
that's a good way to think of it, because we do tend to villainize somebody if they have a higher libido. Like you said, they're considered almost like the horn dog. I can think of very specific friends where they're like, he just won't get off me, or he's always touching, grabbing my ass or something, and it's like, well, that's his way of showing love. That's his way of receiving, like, or even, flip that female to when the, female to the husband, or how female to female, it just, it depends on that individual's needs. And it's not necessarily that it's bad. It's just who they are. And we have to accept all parts of our partners.
Mhm.
Yeah. Well, and I think so much of it is society, right? I think
Mm,
about men and how their sex drives are almost normalized. Like we would expect a male partner to slap our butts. We would expect them to want sex all the time. And that's not true. And then you look at females and you say, well, if females have a sex drive, what's wrong with them?
yeah.
Right? There's
Mhm.
something wrong with them. And it's like, oh my gosh, no way. Like, so I think that pulling apart what's in your garden, right? And I
Mhm.
just love that metaphor, but pulling apart what's in there. So then you have women who shame themselves because they're like, well, I want to have more sex than my husband wants. And you're like, oh, maybe there's something wrong with me. Maybe I need to get, and it's so funny as women, we're so quick to get tested. We're so quick to be like, I'm broken. We're so quick to say, well, that doesn't feel normal because my girlfriends don't say that. And it's like, how about we, within reason, look at our sex lives, look at our sex drives and say, what if it's normal? What
Mm,
if, what if the desires that I have are totally normal for me, especially when done consensually? What does life look like if we just embrace that and we express that to our partners? And what like sexual satisfaction can we get out of this? And what can that look like? I just think that, yeah, I don't know. Society just does a number on us about what we're to expect within ourselves and our relationships. So you got to make sure that you're being true to yourself and you're not doing something because someone expects it of you or your family communicated it this way. Or so that's one of my many.
No, I
I
think
feel
that's totally fair. Yeah, and I think even about like my own experiences and things, like I have a very high libido, and I think that sometimes we have a tendency to, I don't know that we shame ourselves, but if we sense that our partner may not be in the mood for it, then we can all go down that rabbit hole. Like, does he still think I'm pretty? Is he still, do I look, like that whole self attraction kind of a thing? Like, is this a component of it, as opposed to, that other person's mental load might also be tough. Like, I don't know what's going on with this dude during the day and how that could be
Mhm.
affecting what's going on. He may not be taking care of the kids and stuff, but he might be the provider who is having to, do a whole lot of other things that are also shrinking his ability to do so. And then I think for me, a big thing is just, I think it's just a self-assessment of your own health. Like, where are you at within your own sexual health, and what are your triggers in a, and I hate using that word, um, but for knowing whether or not that need is getting met or not. Like, I get cranky. Like,
Mhm.
I'm just gonna own it. Like, I get real. Jen's looking at me. Oh my god, I get real, like, I don't know. I just get real cranky. Like, if it's been longer than what I feel is whatever, just because of life and other circumstances, then I unintentionally get cranky. And that's something that I'm trying to have to really be aware of, is that I can't be that person because of this. I just need to, really express what's on my heart and what's within me, and then, us kind of work it out, because he's more than willing to do, you know what I mean, anything at those points. But that's me holding back from him whenever I'm not communicating clearly what my needs are, and
Right.
I think that that's me putting myself in check whenever that comes into that kind of point
Yeah.
with things. So,
Yeah. And the only, not that you were asking for advice, but the only thing that I think of, especially, because I feel like I mean, I've heard some of y'all's podcasts. I know that y'all are self-aware. I know that you guys are doing the hard work to like be good humans, right? And I feel the same way. I feel like, all right, I'm meeting with people and I'm getting training and I'm doing all this stuff. But the thing for me that has been the most helpful is like when I feel that kind of rising up in me, I will put my hand over my heart. It sounds so cheesy and
Mm.
so like woo,
Love
but
it.
I'll take a minute and I'll put my hand over my heart and be like, what is happening in here? What's going on? And that's like when it doesn't, when the obvious issue doesn't present itself, because, also something I say all the time is the issue's not the issue. So if they vacuum the carpet backwards order than what you expect them to do, or they flip the toilet paper roll the other way, the wrong way, because we all know there's a wrong way. If they
Mhm.
flip it that way, and then that's what sets you off, it's like, okay, it's not about the toilet paper roll. It's not about the way they like, okay, hang on. Maybe I need to take a second, sit on the porch, get away from everybody, and just ask my heart, like, what? Obviously, we're not okay. What's
Yeah.
going on?
Mm-hmm.
So I think that's like when in those moments, it's like we might not know our need, but then like it's our responsibility, I think, to get away before we blow up and
Totally.
yell at them for the stupid toilet paper roll. Like,
You're
but
like, I just need to get laid. That's
I
ultimately what
just
it
need
comes
to,
down
right,
to.
right.
It's so
And
so
like I
simple.
think that, yeah, it's so funny because I work with a lot of men too. And I think that something that I have learned a lot already in this practice is like, man, men can also be so in their heads about sex. They
Mm.
can be so in their heads about how flaccid or how erect their penis is, how long they're going to last. I mean, it is, I can see in some clients like this visible anxiety of like, and I can ask them on a scale of 1 to 10, how erect was your penis? And they know, like, they know
Mm.
it's not always
Wow.
10 every time. Right. And so it's something that they're also very in their heads about. And I think that it's helpful to have that information because it's not that they necessarily find you undesirable. It's not that they don't have a high sex drive. It's that they also don't have the mental capacity to put forth the effort to get
Mm.
aroused and to, then help you to seek your orgasm, which we say, your orgasm is your responsibility. But they can't even be that partner in that position for you guys without having all that anxiety come crashing in for them too.
Mm-hmm.
So
That's interesting.
I
I
don't know.
never thought about like men being in their head about it. I just figured like everything,
Yeah.
it comes easy to them,
Yeah.
We get to do
Yeah.
all the dirty work.
Well, certain
Oh,
medical conditions can exacerbate that too. And especially as they age and things like that, like it can just really become very much they talk to their physicians, their urologists, I think a whole lot about it, but it can really be pretty impactful on them for
it can
sure.
be. But there's also a lot of interventions that they can do. Some are very invasive and some are not invasive. So I think um oftentimes people settle, I think, for lackluster or disappointing sex and because they don't want to talk to somebody about it. So I think that's when, as a partner, you can encourage them to be like, hey, I'm pretty sure there are things that we can try here.
Mm-hmm.
So let's try that because I'm in this with you, you know?
It is interesting to think about men struggling with that because it definitely is not something that crossed my mind, even though as women we talk about it all the time. And I feel like being middle-aged women, it's still such a hard phrase to get to
Mm.
choke out, but like I feel like we're kind of in our prime right now. I don't know. It feels like we've sort of hit our stride and we feel good about ourselves and we've produced children. Like, look what our bodies can do. It deserves to be worshipped. And
Yeah.
and then, we've got, perimenopause right around the corner at this point. And I know, like as men age, you're saying like it can certainly affect them as well. But would you agree, again, just based in on your experience, that this is sort of like the prime time, if you will?
Yeah. So men typically hit their prime at 18. So
Oh, wow.
that's when they hit their prime, their erections are reliable, and they only decline from there. Whereas like women, we hit an arc. And so 35 to 40
Oh,
is about our sexual prime. But yeah, even learning about that, I think can be equal parts frustrating and encouraging for people. But I do think that it helps normalize. And I think you're right. I think at our age, right, our kids are probably a lot more self-sufficient than they were when they were infants and toddlers. We're hitting our stride in our careers where we are communicating. And that's another thing too, is you said women communicate about sex. I don't know if y'all ever ask your male partners, but they do not talk to each other at all.
About anything ever.
Oh my God. My
Sports.
husband talks about sex all the time with his buddies.
Really?
Oh, I get text questions about it. Yes.
I love that. I love that. But I will say that is very rare in my
Yeah.
experience. Men, when they're growing up, they have like Men's Health magazine, they have locker room talk, they have the sex ed class at school, and that's about it for them, right? Maybe what their family said. So I always have a bleeding heart sometimes for men, because I'm like, oh man, women really are far superior in how we communicate about sex than men. But I would agree, yes, that this is more of um our I don't know, I don't know why I'm wanting to say golden hour. That's photography talk, but it's you're more of your stride and your comfort with your body, and even in what your body can do. Like you're saying, your body produces children, right? So of course, sure, I'll get on top. Like here it is. I mean, it's
right.
Ready.
bumpy and saggy, but like whatever, I don't care anymore. Whereas like, when you're 20, you're like, ooh, I have a little bit of fat under my
Right.
rib. It's like, oh, come on. Now it's just like, all right, let's go.
Let's do this.
Very different.
Totally
Yeah.
agree.
It is. It's so freeing, And it's like the one good thing to aging. It's like, oh, okay. Like I'm not as self-conscious as I used to be, and I'm willing
Yeah.
to communicate
Yeah.
most of the time,
Yeah. I don't know if you guys ever talk about, but I think to myself, if I had this level of confidence that I have now, if I had that in my 20s, oh, I mean, I don't even, I would probably be in jail. I mean, I don't even know. I can't even imagine. Or maybe I'd be like on a private island with a sugar daddy. I have no idea. But like the level of confidence that women in our prime, our sexual prime, that's what I was looking for, not golden hour, but our sexual prime, I think, I don't know, we're a force to be reckoned with. So leave it.
completely agree. Well, this has been incredibly informative. I feel like I've learned a lot about how to talk to my kids about sex, because that's important. That is, I want them to have a healthy understanding. I don't want it to be taboo. I want them, as they grow up, to be able to have these like very comfortable conversations with mom, as awkward as that sounds, but like just that idea of like these miniature conversations. I love that. So definitely a big takeaway for me personally from this conversation. How can people find you if we have listeners that are looking, especially if you're here in the Charleston area, or maybe you do virtual therapy as well? How can people find you?
Yes, I do virtual in South Carolina only, but I do in person in Charleston. My website is michelleleach.com. I'm also on Sex Talk with Michelle on Instagram, but I usually just repost a lot of good stuff that I see floating around Instagram, and it can be spicy, but I'm also like, hey, if someone's going to be out there and be brave and say this stat about orgasms or vulvas or whatever, I'm like, hey, someone out there needs to see this. So I just kind of repost stuff, but
I love it.
yeah. I also have on my website, I have a reading resource list. So if there are specific issues, if people are wanting to open up their marriage, if people identify as LGBTQ or polyamorous, or I'm trying to think of what other, like talking to your kid. I have great sex books for kids. So I have a lot of great resources on my website that I've read through almost all of them and love. And so support those too.
Gosh, thank you
Awesome.
so much. That's like gold. Like that's the gold that you're
It
talking
is.
about, but like in a tangible form that we can all use. Thank you so much for doing that.
Yeah. I mean, I've had to, but also chosen to read a lot. And I love, yeah, I love studying about sex. I definitely feel like, all right, I know that I'm in the right career if I'm still choosing to pick up books about the topic. So
I love that. Well, we'll definitely link you on our website as well. And yeah, until next week, find us on Instagram at thelylaspodcast.com. Check out our website. We have our resources on there. We will definitely link Michelle's website so you can go and scroll and find all of those books that she spoke about today in this episode. But until next week, LYLAS, you guys, thanks for joining us.
Thank you so much. Let's talk about sex.
Yes.
Help.